Hi, this is Felicia Brown with Spolutions, and I'm here at the Canadian Massage Conference with Dr. George Roth. George is going to tell us about matrix repatterning, and Dr. Roth, I'm really excited to learn about this because I know nothing about matrix repatterning.
All right.
So why don't you start by just telling us a little bit about yourself and then about your technique?
Absolutely. Well, my background is I've been a chiropractor and a naturopathic physician for over 30 years. I've also studied and trained in osteopathic medicine at an osteopathic hospital in the U.S. and through various other courses. And over the years, gradually realized that I wanted to develop and discover techniques that would address the underlying cause of many of the musculoskeletal conditions that I was involved with treating. Plus, as a naturopath, I've also seen many conditions which have not responded to conventional or even natural forms of treatment. And over the years, I came into contact with a number of practitioners and scientists and researchers who were looking at the underlying factors within the cell structure that were affected by various common injuries. And what evolved from that is recognizing that when you have an injury, like a fall, or a car accident, or a bicycle accident, sports injury, many of these injuries, which include strain but also include impact, are absorbed into the body and are absorbed by the deeper layers of fascia within the skeletal frame and around the skeletal frame, in the periosteum, in the rib cage, and also in the fascia around visceral structures, because the internal organs are fluid-filled structures. And that impact causes those structures to become, basically they get concussed, and that transfers energy to the rib cage, which creates fascial tension throughout the trunk. So we refer to something called deep core injury. And core injury essentially creates strain from the inside out. And so what we've been able to do is develop a technique that allows us to precisely locate these sources of injury and to correct them with very little stress or strain on the practitioner and profound and lasting results for the patient. So we're pretty excited. We've had this investigated by a number of researchers on our board of advisors. We have Dr. Stephen Levin, who's an orthopedic surgeon. We have James Oshman, PhD, who's a cell biologist.
Wow.
And Dr. John Page, who's a Harvard internal medicine specialist and a researcher at Harvard. And they have investigated these techniques, and which are currently used with the Canadian men's freestyle Olympic team. We use it for Olympic horses, a number of athletes in different fields. And so we're pretty excited about the changes we were able to create.
Well, I tell you, just listening to what you're saying, I'm thinking I need to experience this. You were naming things: impact, falls, sports injuries, car accidents. Well, I've had all of those. Yeah. And so I'm thinking that might be helpful for me. Are there any particular conditions that you see most responsive to this type of work?
Well, any structural condition which could involve a history of injury, but we see anything from neck pain to back pain, shoulder injuries, carpal tunnel syndrome, a lot of knee problems. We've been able to actually help people avoid surgery for hip and knee replacements. We've also been able to help even people heal from previous fractures that weren't healing properly, non-union of fractures. But also just general muscle strain, things in terms of lack of mobility, joint instability, all of those kinds of issues. And so practitioners from massage therapists to physiotherapists, chiropractors, and even veterinarians who have in our program now have trained in it. Even dentists are using it for TMJ disorders and tooth issues as well, tooth sensitivity issues.
Wow. I mean, it sounds like it's applicable to a lot of different conditions.
Yeah, but some of the unusual ones which have come along over the years, sort of by accident, we found that we were able to actually normalize structural strain, for example, in the diaphragm area by releasing tension in the rib cage. And many people have reported that they no longer have reflux conditions as a result. And as well, we've been able to normalize many people who have snoring and sleep apnea problems because of visceral tension affecting the throat and fascial tension from the chest affecting the tongue position in the airway, as well as cranial techniques which also support that.
Well,
process.
I can already see what I'm doing tomorrow. I'm going to be getting a session of this at some point in
Absolutely.
time.
Yeah.
So, aside from all the benefits that patients and clients are going to get, the relief from these conditions that in some cases may have been affecting them lifelong, perhaps.
Yes.
What are some benefits to therapists learning this type of technique?
Well, a number of massage therapists who have come to us, and even other practitioners like chiropractors, who are finding the stress and strain on their own bodies of applying some of the vigorous techniques that are used in those treatments, have come to us, and after learning this technique, they've basically reinvigorated their practices. There are even people who have been in practice for over 30 and 40 years have found that they can do this with very little stress on their body. The forces are applied are just ounces of pressure applied to different structures, and so it's very, very gentle. It's a question of addressing where the problem is coming from. The source of the condition is often not located where the symptom is, and that's due to the fascial tension that is created. So if you have an injury, for example, if you've fallen on your hip or your knee, the fascial tension coming from those injuries creates tension through the extracellular matrix that's transmitted to other structures, which then have to compensate for that. So you might have symptoms like shoulder pain and neck pain, when in fact we find the injury may be in the rib cage or in the pelvis or somewhere else. And correcting that relieves that fascial tension, allows for normalization of muscle and joint function.
So, just to make sure I'm understanding, this technique is really addressing the fascia, is really working with the fascia to restrict
deeper
or to
fascia,
release that.
deeper fascial structures, often related to deeper layers, including literally intraosseous structures, fascial structures around the viscera, internal rib issues, which literally are affecting the intercostal area and the spinal areas. So what we refer to as deep core issues, which are essentially due to many conditions, especially injuries like impact injuries, which most people just don't realize create long-lasting fascial imbalance in the body that really change the cell structure. And what's neat about it too is we can precisely locate these areas because within the cell structures, when it's injured, there's a change in its electrical profile, which we can test very easily just using manual techniques to assess those changes and very objectively assess them and locate them and then treat them.
So you're doing some assessment that helps guide the process as to what treatment you're going to do.
Absolutely.
And then I'm just curious, how often do people come in for this type of a treatment? Is it something where it's going to be a one-time fix, or is there a protocol of a number of sessions depending on the condition?
Well, most people have had more than one injury, for one thing, and injuries build on top of other injuries. So what our goal is to unravel layers of injury, and we can easily detect those and pick those up, and then through a process of typically 6 to 12 sessions. For the average well patient, it's quite sufficient to normalize most chronic conditions. And so it's a finite process. Patients love that because they don't have to keep coming back for treatment. But we get tremendous number of referrals as a result. I still get referrals from patients I haven't seen over 20 years who are just well, and they tell me they're still doing great, and it's gratifying, I got to say.
I'm sure.
Yeah.
So I know that you've been teaching here at the Canadian Massage Conference, but obviously not everyone has been able to get here.
Yeah.
How can people take classes with you, and do you have a website or some information you can share?
Yeah, our website is www.matrixrepatterning.com. We have ongoing seminars for practitioners, and we have a neat group. Usually we have an eclectic group of massage therapists, physiotherapists, chiropractors. We have veterinarians in the program now. Dentists have also taken the program, physicians. And those courses are basically an introductory program. Our next one is February the 8th, 2012. But we have those introductory programs on a regular basis. Those are one-day programs. And then there are advanced programs, which can involve up to a year-long process of one module a month, which is about 30 hours per module. So we cover the entire body. There are supervised clinical programs with actual patients. And so it's a program where you can eventually become a certified matrix practitioner and receive the benefits of the referral database that we've created. And we have patients really traveling from all over the world seeking this type of care, but because they have discovered or heard that it's able to alleviate many conditions that have not responded to other forms of therapy.
Well, I'm excited to hear about this. I was plenty of injuries to work on here, let me tell you.
Okay.
So I'll definitely do that. But thank you for
All right.
coming in and
My
talking with
pleasure.
us today, Dr. Roth. And I encourage you guys to check it out and learn more about his classes.
Okay.
Thank you.
Thank you.